brings us very nicely to the second speaker. A few years ago, Pakistan, we've kind of written about this as well in our own kind of approach to dengue. They were the victims of one of the worst ever outbreaks, global outbreaks of dengue. They responded in an amazing way. And by that, one of the amazing ways that we felt was very amazing was the development of a tracking system, an app-based tracking system, which I'm sure the next speaker, Somia Iqtadar, will talk about. But we were so impressed with that, an amazing system, that we actually gave them a recognition award as part of our Science Communication Recognition Awards a couple of years ago. I think there might be even some interest from Ryan's side in terms of how these things can be used to bring communities in. So I'm sure there'll be a lot of interest in your presentation, Somia. I think it'd be nice to hand over the floor to you now before I steal any more thunder in terms of the presentation. I'd like to hand over to Dr. Somia Iqtadar, Chairperson of the Government of Pakistan's Government of Punjab's Dengue Expert Advisory Group. Over to you. Round of applause and over to you, Somia.
Thank you very much, Dr. Kamran, for your very kind words. So, ladies and gentlemen, today I will be talking to you about life in Pakistan, which was going on very smoothly, very peacefully, and people were enjoying in parks. But all of a sudden, our parks had to go deserted. There were beautiful fountains in the city to which I belong, Lahore. It is the city of gardens and city of fountains. But we had to ban all the water bodies and dry all the water bodies. The swimming was banned, all the water bodies across the province, and especially in the Lahore, were dry. And this happened in the hospitals which were smoothly running and catering to the patients, that they turned into dengue hospitals. This is when Pakistan, in the province Punjab, experienced the worst ever reported dengue episode in the world, in which we had approximately 0.6 million suspected cases, and out of them, 22,000 were lab confirmed cases. And I'm sure there were many more which were missed. We lost 375 precious lives in a span of 73 days. And this is the shortest span of the time in which the deaths have been reported so high. And then the cases started emerging with every passing day. And we had absolutely no experience of coping with an outbreak of this magnitude of a disease which was not known to us. And all efforts were based on simple mosquito control. The news headlines were always full of the deaths and the number of cases of dengue, and not only national media, but international media also highlighted it as the numbers started to grow with every passing day. But as you say, that every challenge is a disguised opportunity for salvation. And being human in the digital world is about building a digital world for humans. So we took this opportunity as a challenge, and that is when we started our dengue tracking system in Punjab, Pakistan, which helped us cope with this epidemic and in future control the dengue problem. And it has proved to be a very, very useful application, and it is recognized all over the world. So today what I'm going to talk to you is about the advocacy and social mobilization, in which is a part of our dengue control program. Then surveillance and vector control activities. Then what changes we made in our clinical case management. How did we build our capacity by training of the field staff and our doctors? And the most important part of our dengue prevention and control program, which is the critical interventions in IT, of which the part is the dengue tracking app that I'm going to talk to you today. So the steps that we take, advocacy and political commitment, you all know, is the basic fundamental need if you want any program to be successful. So when we were taken on by this unknown, unforeseen challenge of dengue cases, So we formed a central emergency response committee, which was chaired by the chief minister of the province. And it has subcommittees like town emergency response committees. And then we finally launched, in the guidance of our political will, prevention and control program of epidemics in Punjab, of which dengue is a part. Since it was a new disease to us and we did not have much experience of coping with epidemics of this magnitude, neither our doctors were trained or seen many cases of such disease. So we got support from our international experts, mainly from Sri Lanka, Thailand, Malaysia, Indonesia, and Singapore. All the Southeast Asian countries very graciously helped us in our capacity building, and we learned about this disease over the period of years. This is when our government took the initiative of sending a group of 100 people to Ministry of Health Sri Lanka and Asian Institute of Technology Thailand with Ministry of Health Thailand, and they devised a program, customized program for dengue epidemic prevention, control, and management, which was known as DEPCAM. And it trained about 100 people, which then served as a master trainer and came back to country to disseminate their knowledge in their respective fields. This group consists of doctors, clinicians, pediatricians, and adult physicians both, nursing and paramedical staff, environmental control inspectors, virologists, entomologists, and a lot of field workers who help in controlling the dengue in our country. It is then when we formed the Dengue Expert Advisory Group, which I am representing today. Dengue Expert Advisory Group is a body of clinicians who devise protocols for management, clinical management of dengue fever in the province Punjab, and we provide guidelines to the doctors how to manage these cases. And for this initiative, we have developed certain documents. And these documents, they serve as a key component to our dengue tracking app. That's why I'm sharing with you these documents, because this fills all the relevant information related to the patient. We have a dengue counter in place in all the healthcare facilities where the patients report. And in real time, all this patient record is entered into the dashboard, which is then conveyed to the district administrations for carrying out the necessary actions for surveillance and case response of that particular case. We have also developed few documents regarding guidelines for clinical management, and we are in the process of developing guidelines for the pregnant population as well. Dengue Expert Advisory Group has been very active in conducting the training workshops for doctors and paramedical staff all across the country. And the critical IT initiatives have been very helpful in controlling the dengue spread in our country. We started with a vector surveillance system in January 2012, right after the epidemic. After that, we had the dengue tracking system. Then we started the patient reporting system a few months later. Then we have dengue virus report application. And we also, with the passage of time, improved our system by introducing a third-party validation. And recently, we have added the general practitioners application, in which we take the reporting from the family physicians in our system so that no case is missed. There's also a dedicated health line with a specific number, pre-toll number, provided to all the citizens where they can lodge their complaints. So just taking you through that app, this is an anti-dengue application, which has a screen. On the login screen, you need to enter your username and password. And then it takes you to the main screen, which shows you different icons. And these icons are under construction building, graveyards, some vacant building, workshops, schools, dispensaries, institutions, factory areas, hotels, hospitals. So you enter an activity by doing a surveillance of the particular area and marking it. So whenever you see any breeding spot or any larva is found or mosquito is found, you tag that particular place, and then you do the needful. So corrective measures are taken, and a before and an after picture is added in the system so that it is recorded in the system. So the dengue tracking system is operational in 36, that is all 36 districts of the province Punjab, more than 50 departments, mainly the health department, but other line departments like environment department or labor department or school education department, they are also part of the system. We have more than 120 million activities now. 22,000 Android users use this application who identify different hotspots in their surroundings, register them to the system. Then the second part of this app is the patient reporting system. The patient reporting system is placed in the government and the private hospitals along with the labs. And this includes both the private lab facilities and the government lab facilities. So whenever the patient reports in any of the healthcare facility, it is entered into the system, and it is then the case response is done at the home address and the workplace address of that particular patient. These patients are all marked and geotagged, and we also have a complaint management system related to health, which is our dengue virus report generator. And these DVR complaints from 36 different and helpline complaints, they are addressed on a regular basis in our cabinet committee meetings. This is the vector surveillance system that I am talking about. So the indoor surveillance, the outdoor surveillance, and the Brettu index calculated. This is all entered into the system with the help of this application, and it gives you a fairly good analysis of what is going on in the season regarding dengue. In the dengue patient reporting system, the system is operable via a laptop in which all the data is entered in the hospital when the patient reports. It starts right from when you suspect the patient, you enter the name of the hospital or a healthcare facility, the address of the patient, and all the necessary documentation is done and uploaded in the real time. On the basis of this, there is an epidemiological report and line listing of the patient which is created, and all this information goes to the dengue activated tracking system, which then comes into place. And this then geotagged management system help us to identify the hotspots in our country, do the corrective measures, upload the before and after picture, and get rid of the disease burden. So this is how the whole system works, that there's a patient entry on portal and patient tracking through the application, then the case response, and that is how we curb the disease. It's just to give you an idea how the system works, that from hospital, data is entered, the performance in the field is also captured with the pictorial evidence, not only the house from where the patient reports, but 12 houses in front, 12 houses on back, on right, and on left. So total of 49 houses are screened for any dengue larva or mosquitoes, and IRS or larvicidal activities are done. Before and after pictures are added, and then the data is entered as if the case response is done and what was the problem identified in that area. We have also developed a system of generation of alerts. There are three types of alerts that we generate. One is the vector-based alerts, other is the World Health Organization-based alerts, and then there is a GIS-based alerts. The vector-based alerts are given when there is a Brettu index, which have cutoff value of more than 3% in the endo, and this marks the beginning of a potential dengue season. Every day, there is a consultative meeting in the Institute of Public Health, and they send an email and an SMS to the relevant authorities about the daily report. The World Health Organization criteria we also follow. An alert threshold is when there are 3 suspected and probable case of dengue and 1 lab confirmed case. So this is when they're alert. An outbreak we label whenever there is single confirmed case and or 6 probable or suspected cases. Then this is the outbreak threshold. We have also developed another system which is developed by PITB and support of DIAG, in which we see that how many patients lie in one particular area. So whenever the patient is marked, then that area is circled. And if 3 circles within 1 kilometer radius overlap with one another, then this GIS-based alert is generated, showing the clustering of patients in that particular area, which can then act as a hotspot for spread of disease. We are also working on the SAT-SCAN alert, in which we take positive larva, weather data, and location in consideration for alert generation. We regularly analyze our activities and grid them according to the number of activities which are performed in a particular area. If the activity number is sufficient, then it is labeled as green. But where the activity number or surveillance is less, it is labeled in red, and more emphasis is given on the field activity of these particular areas. These are real snapshots from some of the areas of Rawalpindi in which we had a 2019 epidemic, and we do the regular analysis, and grid patterns are created for better analysis of the situation. So there is a case evidence with the help of this geotag reporting as well. So we identify where the cases are coming from, and we look at the activities which were performed before the cases presented in that area and see if sufficient surveillance was done to curb the disease prior to the reporting of the cases. And if there was any larva or mosquito found before reporting of the patient. And after the patient is confirmed from a healthcare facility, then the case response is done and again seen if there are any larvae or mosquitoes found in that area. So a relation of all this also gives us an idea how the system is working. BRETU index is one of the indicators that we use for alert generation. And whenever the system tells us that the BRETU index is more than 3, then this is a high alert, and we do a sweeping activity in that particular area to enhance our surveillance in that area to get rid of the disease and stop the disease from spreading to the other adjacent areas. We have a robust health complaint management system in place since 2011, in which the citizens can lodge a complaint against whether there is ponding of water, or if there is sewage blockage, or if there are mosquitoes in that area, or if there are any under construction sites which can act as a hub of mosquito breeding. So they can lodge and identify their places on the system, and then we redress these complaints. We have recently launched another application, which is the General Practitioners application, because we identified that we are missing out on the patients who do not report to the healthcare facilities, but they go to a nearest doctor or a local GP. So we have developed this application, which is again a smartphone-based application for reporting patients via the general physicians or the family physicians through their phones. They can open and register and have their account over there, and then can enter the suspected, probable, or confirmed case to be the part of larger system which is deployed in the hospitals. We have also started a third-party validation. This application is used to conduct the audit for the activities, and then this audit report can be viewed from the dashboard so that the administrative authorities can do necessary actions against them. You know that no program of dengue control and prevention is complete unless and until we have the active public awareness and social mobilization component attached to it. So we do make it a part of our app so that all the activities regarding awareness, whichever are done in whatever area, they are also recorded in the system, whether they are in the form of walks in which the patients put on the pictures before of the walks, or if there is distribution of pamphlets, or if any phone calls are made by any organization regarding dengue awareness, they are also added to the system as part of awareness activities, and we have a record of them. We use every possible medium of patient and public involvement in controlling this menace. We make it interesting by using different media like mural paintings, like theater, and poster competitions in schools, and training our school teachers and students as well by introducing a zero period regarding awareness of disease dengue to the students in schools and colleges. We also publish a weekly bulletin about different diseases, and this is the focus is also done on dengue fever, especially in the monsoon period. Our health department sends out a patient summary every day in the form of a SMS to all the stakeholders, and the critical technological interventions pertaining to dengue are also communicated to all the deputy commissioner officers so that they can look into their specific region and do the corrective measures. And the impact of this dengue tracking system has been enormous because we have been able to bring down our dengue mortality, which was a bit high in the beginning when the disease and the system was new and the system was not in place, to a considerably low level. You know that global analysis shows that approximately 2.5% of the cases of the dengue die. But if we've been fortunate to have this system in place and train our doctors, paramedical staff, field workers, entomologists, and the administrative people. And this is reflected by decrease in the dengue mortality rate over the years. For this very purpose and this app, International Society of Neglected Tropical Diseases in 2020 gave us an award as the best dengue activity tracking system of the world, and we are very grateful for that. These are the collaborating partners, the Government of Punjab, the Dengue Expert Advisory Group, which I represent, Punjab Information Technology Board, which gives us all the support for this dengue tracking, and World Health Organization. We are constantly in collaboration with them. You will be able to hear their stance tomorrow as well in the Pakistan session, and King Edward Medical University, where I'm teaching as Associate Professor of Medicine. Thank you very much for your patient listening. If you have any questions related to this presentation or otherwise how our system works, and if we can be of any help to you regarding clinical management of dengue patients, we are there for you. You can contact us at our email, our website. We are present on Twitter, on Instagram, on Facebook, and on YouTube. Please feel free to catch up with us. Thank you very much.
Thank you very, very much, Somia, for that excellent presentation. That impact slide that you showed at the end really highlights the effectiveness in terms of the mortality rates coming down after you've implementing this particular tracking system. And I'm pretty sure, well, one of the reasons we put these 3 days together is to progress through partnership, collaboration, and I'm very hopeful that at country level, people are getting in touch with you guys to learn best practices, ways forward, issues that could be resolved using this particular type of approach. Some great comments coming through. So Professor Zulkifli Ismail, the head of the Malaysian Pediatric Society, great presentation, Somia, impressive use of technology. We've had quite a few kind of, people saying that. Dr. Ken Kwok Do, very nice presentation, Dr. Somia. May I know who uses the app, medical staff, non-medical? We can come into those questions at the end in the Q&A, but I'd like to say thank you very, very much, Somia, for a really clear explanation of what you guys have done and what you've achieved. Brilliant, so thank you very much for that.